The goal is to end the AIDS epidemic by 2030.
Fears over how the AIDS virus is spread.
Back in the early 1980s, HIV infection was often seen as a death sentence. By 2000, more than 28 million people were living with HIV, but only 1 in 50 received antiretroviral medicines. Overall, 35 million people have died and 76 million have become infected. But today, the scales have tipped. Yearly, AIDS-related deaths have almost halved since 2005. More than 50% of people living with HIV have access to treatment. And a person living with HIV who starts treatment today has the same life expectancy as someone who is free of HIV infection. Pressure from the global AIDS movement has made medicines affordable in almost every country. $75 will cover an adult for an entire year. But there is still much work to do. 17 million people living with HIV still don't have access to treatment. Young women in sub-Saharan Africa are especially at risk. Their rate of new HIV infections is 44% higher than among young men. AIDS-related deaths have risen in the Middle East, North Africa, and also in Central Asia and Eastern Europe, where people who inject drugs account for nearly half of new infections. AIDS is not over, but it can be. UNAIDS, leading the global effort to end AIDS as a public health threat by 2030.
Assalamualaikum warahmatullahi wabarakatuh. Today I will explain about the National Strategic Plan Ending AIDS in 2016 to 2030 policy. Firstly, HIV is a virus that attacks the immune system, and AIDS is the most advanced stage of this infection. It weakens the body by destroying white blood cells, making a person more vulnerable to disease. HIV spreads mainly through unprotected sex, sharing needles and contact with infected bodily fluids, and it can also be passed from a mother to her baby during birth. Malaysia recorded its first AIDS case in 1986 and increased in the following years. The government has taken many initiatives to prevent AIDS, from fear-based messages in the early days to more compassionate and awareness-based campaigns today. To strengthen national efforts, the Ministry of Health introduced the National Strategic Plan Ending AIDS 2016 to 2030 policy. This strategy builds on past achievement and addresses weaknesses identified in the midterm review of the 2011 to 2015 plan. It focuses on stronger collaboration with civil society and aims to achieve the Global 95 target, ensuring the most people with HIV know their status, receive treatment, and achieve good health to prevent further transmissions. Planning is crucial because HIV is still not curable, making prevention and treatment essential. Therefore, this project will discuss the National Strength Plan Ending AIDS in detail, from the main problems, strategies to prevent HIV transmission, and the effectiveness of the policy in Malaysia. Next is the policy objective. The main objective of the National Strategic Plan Ending AIDS in 2016 to 2030 is to end AIDS in Malaysia by the year of 2030. This means achieving a 90% reduction in new HIV infections compared to the numbers recorded in 2010. Based on the AIDS epidemic model, this target reflects Malaysia's commitment to controlling and eventually stopping the spread of HIV. To support this goal, the policy includes fast-tracking action plans, which are accelerated strategies designed to quickly improve HIV testing, treatment access, prevention initiatives, and support services. Alongside this, a strong monitoring and evaluation framework is implemented to continuously track the progress, identify gaps, and ensuring that all interventions are effective and aligned with the national goals. The last objective is to ensure that in the second phase of National Strategy Plan Ending AIDS, which is in 2021 to 2030, focuses even more on eliminating AIDS as a public health threat. This means reducing HIV transmission to very low levels, ensuring early diagnosis, strengthening treatment coverage, and improving the quality of life for people living with HIV so that AIDS is no longer a major health burden in Malaysia. Next is the policy problem. Firstly is the HIV and uneven disease burden. Malaysia continues to face a persistent spread of HIV with cases concentrated unevenly across states. This uneven distribution is influenced by population differences, high-risk behaviors, and variations in healthcare access. Understanding these geographic disparities is essential to focus resources where they are most needed. The second policy problem is the limited access to testing and treatment. One major issue is the difficulty in getting people to undergo HIV testing and receive timely treatment. Many individuals are diagnosed late because they are unaware of their infection due to low awareness and inadequate early screening. This leads to delayed treatment and increases the risk of further transmission. The next policy problem is the limited access to testing and treatment. One major issue is the difficulty in getting people to undergo HIV testing and receive timely treatment. Many individuals are diagnosed late because they are unaware of their infections due to the low awareness and inadequate early screening. This leads to delayed treatment and increases the risk of further transmissions. The last policy problem is difficulty engaging high-risk groups in treatment programs. High-risk groups such as people who inject drugs, sex workers, and transgender persons are harder to reach and retain in treatment programs. For example, people who inject drugs face challenges in completing the opioid substitution treatment. It shows that these barriers reduce treatment effectiveness and make it harder to control the spread of HIV.
Alarming rise in HIV cases, or the virus can even be managed. Individuals, especially those who exercise risky behavior, need to take the first step: testing.
Next, we move to the strategy. The first strategy, NSPEA, focuses on strengthening HIV testing and treatment. One of the key actions is the creation of unified testing guideline. This means all health facilities, whether clinics, hospital, or community centers, need to follow the same standard procedure for HIV screening. By standardizing the way of HIV testing is done, the health system becomes more consistent, more accurate, and easier to the public to access. Another important point under this strategy is the effort to speed up treatment. Early detection is critical because it allows patients to start the therapy sooner, which reduces complications and help to prevent further transmission. This strategy ensures that HIV testing is efficient, reliable, and connected to fast treatment so that the patients can be diagnosed at an early stage. The second strategy focuses on people who inject drugs, or PWID, who are identified as a high-risk population. This is because sharing needles is one of the fastest ways HIV can spread. Under this strategy, programs such as Needles and Shrink Exchange Program (NSEP) are provided. This program allows drug users to obtain a clean and unused needles and other injecting equipment at little or no cost. This approach reduces their dependence on shared needles and significantly lowers the risk of HIV transmission. It also helps connect PWID to healthcare services, counseling, and treatment options. This strategy recognizes that harm reduction is more effective and humane than punishment, and it plays an important role in protecting both the PWID community and the general population. The third strategy deals with reducing stigma and discrimination, which continue to be a major barriers in the fight against HIV. Negative social attitude and institutional bias can discourage people from getting tested or seeking treatment. When individuals fear of being judged, labeled, or rejected, they are more likely to hide their status, and this delays treatment and increases the risk of transmission. Therefore, an SPEA aims to create a supportive environment where people living with HIV do not feel marginalized. The strategy focuses on emotional, social, and community support to help affected individuals build confidence and access healthcare without fear. Reducing stigma not only protects the right of people living with HIV, but also strengthens the overall effectiveness of national HIV prevention and treatment programs. And the final strategy emphasizes the importance of having strong, high-quality strategy information for policymakers. Accurate data from monitoring, evaluation, and research is essential because it helps the government understand who is most affected, which programs are working, and what needs to be improved. When the data is reliable, policymakers can design more effective interventions and allocate resources where they are needed most. This strategy encourages ongoing research, proper data collection, and strong analysis so that Malaysia's HIV response remains evidence-based, updated, and aligned with national goals. In short, this strategy ensures that every decision made under the HIV program is supported by facts, data, and real-world evidence.
At first, she struggled with poor health. Then, in 2004, she started taking antiretroviral medicine.
ហ្នឹងគឺអ្វីដែលគោលម្ដងដែលខ្ញុំចង់បានហើយបើសិនជាគ្មានថ្នាំនេះប្រហែលជាមិនមានមុខនៅថ្ងៃនេះទេចា៎
Now, Disoka is a counselor for the ARV Users Association. She is supporting other people living with HIV.
So next, I'm going to explain about the strength of this policy. So the first is focus on the HIV treatment cascade. Malaysia placed strong emphasis on ensuring people living with HIV receive proper care. The global goal was to meet the 90-90-90 targets by 2020, which means 90% of the people with HIV know their status, 90% of diagnosed individuals receive treatment, and 90% of those on treatment achieve viral suppression. To support this, Malaysia provides free antiretroviral therapy ART to all individuals regardless of their CD4 count. Secondly is successful prevention of mother-to-child transmission, PMTCT. Another strength is the success in preventing HIV transmission from mothers to baby. Nationwide HIV and syphilis screenings are done during the antenatal checkups. Pregnant mothers who test positive are given free ARV prophylaxis and infants receive the proper medical support, such as formula milks and else. This has helped greatly reduce new HIV infection among babies. Next is the comprehensive harm reduction programs. Malaysia also implements strong harm reduction strategies. This includes opioid substitution therapy (OST), which help people who inject drugs, which is the group with the highest HIV risk. Through OST, individuals can access safer alternatives, reducing unsafe injection practice and preventing new infection. Last but not least is the strong government and NGO partnership. Malaysia's HIV response benefit from strong collaboration between the Ministry of Health (MOH) and the community organizations such as Malaysian Aid Council (MAC). This partnership help expand outreach, especially to key population who may not access traditional healthcare facilities.
News here, the U.S. Food and Drug Administration has approved a new HIV prevention medication that has been found.
It wasn't so long ago that AIDS was a guaranteed death sentence.
It's being called a game changer in the fight against HIV, an injectable drug that's been found to be nearly 100% effective.
We're seeing 1/4 of all new infections in the United States occurring in people
raise awareness about HIV and AIDS.
Next, I will explain the weaknesses of the National Strategic Plan for Ending AIDS. Although the program has shown progress, there are still several important challenges that continue to slow down the overall effectiveness of HIV prevention and treatment efforts in Malaysia. These weaknesses must be understood because they directly affect the continuity, accessibility, and quality of services provided to the community. The first point is financial resource constraint. This is a major challenge affecting the sustainability of the HIV program in Malaysia. Although the government provides a fixed allocation, a large part of the funding still depends on the international sources such as the Global Fund. Due to this dependence, many important activities such as treatment, awareness campaigns, and community programs cannot be carried out continuously in all states. In addition, budget constraints also make it difficult for the government to expand ART treatment and provide psychosocial support services, especially in rural areas. In conclusion, without sufficient funding, access to HIV treatment and prevention becomes unbalanced throughout the country. The second point is the shortage of workforce and implementation capacity in the field.
NSPEA requires many health workers such as medical officers, HIV counselors, and community workers to conduct screening, community education, and treatment monitoring. However, the MTR 2022 report shows that the number of officers is still insufficient, especially in Sabah and Sarawak. This shortage causes the yearly detection process to be slow, and health services are difficult to reach by at-risk groups. Continuous training for health workers is also lacking due to logistical and allocation constraints. This ultimately affects the quality of program implementation at the grassroots level. The third point is legal and policy barriers. Although the NSPEA emphasized the leave no one behind approach, our legislative system still prevent health access for certain at-risk groups. For example, teenagers under 18 cannot undergo HIV testing without parental or guardian consent. This barrier prevents many teenagers, including those who are sexually active, from knowing their health status earlier. As a result, many HIV cases among youth are only detected at a late stage. This makes it difficult for the country to achieve the 95% yearly diagnosis target by 2030. The last point is the issue of stigma and discrimination. Although the NSPA policy prioritizes the goal of zero discrimination, society still has a negative perception towards people living with HIV. This discrimination occurs in the workplace, in the community, and even in health facilities. Many individuals are reluctant to undergo testing or continue treatment for fear of being stigmatized. In addition, laws related to same-sex relationships and sex work also prevent the harm reduction strategy. Groups such as MSM, Men Sex with Men, sex workers, and transgender individuals often face the risk of arrest and social stigma, causing them to distance themselves from government clinics.
Next, there are some recommendations to overcome the weaknesses that my friends mentioned before. Firstly, the government can optimize the use of existing resources in order to control financial resource constraints. One of the ways to optimize the use of existing resources is by decentralizing and including HIV services within the current program and primary health care. Instead of depending solely on specialist HIV clinics, move the routine HIV testing and stable patient follow-up into the specific primary care or clinic networks such as klinik kesihatan and klinik community. Besides, the government can increase the funding for implementing programs from domestic sources such as public budgets, health insurance, and private sector rather than external donors such as international grants. For instance, collaborate with the private sector, including the employers, private health providers, and civil society to make contributions, either through social financing tools, in-kind contributions, or financial contributions. This can ensure all communities help the government to take action in addressing HIV issues. Secondly, targeted outreach and inclusive awareness campaigns is one of the recommendations to overcome the lack of manpower and implementation capacity in the field issues. Generally, government clinics in Malaysia, especially in rural areas, have limited staff which causes Ministry of Health facilities unable to reach hidden populations. Through targeted outreach initiatives, the system can reach more people outside of clinics by recruiting additional medical staff for mobile outreach days, HIV counselors for education, testing, and psychosocial support, community health workers for follow-up and distribution of HIV self-test kits, and also peer educators through NGO partnership for better participation in prevention programs. This support not only can avoid manpower shortage, but also can boost testing uptake, deliver stigma-free prevention messages, and guarantee early linkage to treatment. Thirdly, one of the recommendations to overcome legal and policy barriers is policy reform and human rights advocacy. The government should reduce or modify the legal consent age for HIV testing, counseling, and treatment, or let mature teenagers give their own consent. This modification is intended to ensure that regulations specifically provide access regardless of key population status, gender identity, and sexual orientation. Other than that, the government can adopt rights-based health policies such as informed consent for testing and treatment, safeguard privacy, and protection against forced disclosure. It is important for persons living with HIV to be treated equally in all health services, including employment, housing, medical treatment, and social assistance. Last but not least, utilizing digital media platforms is one of the best recommendations to overcome stigma and discrimination that remain as barriers. In this era of globalization, the primary mediums are digital and social media. Most of the people, especially young people and groups that often avoid traditional health facilities, use digital platforms to get accurate sexual health information due to fear of prejudice, condemnation, or exposure. Therefore, the government should expand and provide more digital platforms to improve citizen engagement and provide better public services. For instance, Jom Prep app is one of the digital platforms used to increase the uptake of HIV testing and pre-exposure prophylaxis among men who have sex with men (MSM) in Malaysia. This app is one of the platforms used in Malaysia to provide MSM with HIV prevention services. However, the government can further expand and support applications like Jom Prep by focusing on other populations too, such as transgender, war, youth, and so on. By having a digital platform, it not only can prevent barriers like stigma and discrimination, but also can improve testing uptake and increase HIV prevention in Malaysia.
To conclude, Malaysia has shown strong commitment to addressing the HIV and AIDS epidemic through the National Strategic Plan for Ending AIDS 2016 to 2030. The government aims to improve the quality of life for people living in HIV. It works closely with governmental and non-governmental organizations to strengthen policies and expand testing services. Harm reduction programs are also supported to reduce new infections. Progress towards the 95-95 target shows that community-centered efforts are effective. However, challenges such as limited funding still remains. Restrictive legislation also affects the speed of progress. Malaysia needs continuous innovation and strategic use of existing resources. Targeted outreach and inclusive awareness campaigns are essential to reduce stigma. With sustained collaboration and supportive laws, Malaysia can move closer to ending AIDS by 2030.
We've come a long way, from a world with illness, fear, and death, to one filled with health, hope, and life. We did the unimaginable. End AIDS by 2030. This is a unique opportunity. As never before, we have powerful tools to prevent, test, and treat all. All we need is everyone to do their part. Take the challenge. End AIDS.